Well, welcome to IPPI's update on the coronavirus and our response. I thank everybody for joining us and participating in this update. Hopefully this information will be good for at least a few days, but this is current as of March 12th. I want to start by introducing myself. I'm Le'Ann Milinder. I am the State Director for IPPI in New Hampshire. And I wanted to let you know a little bit about what we're doing to address COVID-19. The senior leadership team is meeting daily to assess the situation, make proactive decisions, problem solve. We're monitoring public health guidance, updates from the CDC, the news, and obviously any information we get from our funders and the state regulators. And we're really making sure that we have the latest information and guidance. In every state, we have updated, detailed emergency plans to ensure that we can continue to provide services to people, and obviously we are always wanting to reduce the risk to anyone in the IPPI community. In each state, there is a team for coordinating our response to the novel coronavirus, COVID-19. Local conditions are different across the different states, and so it's important that we have those local teams in place to respond. As you probably know, this is a rapidly evolving situation. The very first patients were observed in December of last year in just one country, and in these 3 months, we've gone to a pandemic that's widespread on 6 continents. Here in the United States, as of yesterday, there was all but, I believe, 8 states had reported cases. There are cases. There were no cases in any of the states where we operate 3 weeks ago. Now there are cases in all 5 states where we operate, and 2 states have declared a state of emergency, but no one at IPPI, either people served, employees, or subcontractors, have been diagnosed with COVID-19 as of today. So things are changing rapidly. The general responses for us and for the whole community to the virus are twofold: containment and mitigation. When a new virus first appears, the focus is on containment, trying to keep the virus from spreading to new locations and new populations. So when the virus first appeared, the focus was to identify people who were at high risk for the virus, get them tested, get them isolated at home and quarantined, and then if they're test positive, to continue to isolate them and look for all of their contacts and then quarantine those people, really trying to prevent the virus from going anywhere, stopping the virus. But once a new virus is widespread, the focus then also includes what's called mitigation, and that's slowing down the spread of the illness so that the community can cope with the outbreak. I want you to think about this in terms of your own family. Ideally, you want to prevent an illness from coming into your home ever. And at the community level, that's the containment phase. Stop it from coming here at all. But if one family member becomes sick, most households can cope. You change your routines, you gather your resources, you cope. Grandma comes to take care of the kids, one person maybe stays home from work, you can still get your grocery shopping done, you still can function. And if no one else becomes sick until that first person is well, you get through it okay. But if your whole family gets sick at the same time, you have a much harder time. You might need extra help, resources to care for family members, maintain your home, get food, supplies, and medical care. Well, mitigation is slowing down the spread of the virus so everybody doesn't get it all at once and overwhelm systems of care. Because communities are a lot like families. If there's just a few people who need help, we can all cope with that surge. But if there's a lot of people that need help, it's much harder to cope. So here's a graph that shows what it's like for the healthcare system. If we look at that dotted line as the number of sick people that a healthcare system can take care of, or a system like IPPI and our long-term supports and services, over time, if all the people get sick all at once, it might exceed our capacity, like that that red area there. Too many people for us to cope with, and too many people for the hospitals to cope with. But if we spread out the same number of cases over a longer period of time, people might still get sick, but we're better able to cope with the system. And mitigation is designed to do what's called flattening that curve and having those cases come on more slowly so that we can cope better. You have an important role to play in mitigation. The U.S. is moving from containment to mitigation in many parts of the country. Containment is still the goal in many places, but it may no longer be possible. We have to assume that many people will be exposed to COVID-19 and many will become sick. And what we want to have happen is to have those illnesses be spread out over a longer period of time so that we as a community, locally, at IPPI, at the states, the national level, can cope with that effectively. We have the opportunity now to reduce the impact of COVID-19 on the individuals we support, our families, and communities, and we can do it. There's some good news. We should have optimism about certain things. You can reduce your risk by taking preventative steps. Most people who get COVID-19 experience mild or moderate illness. For people with mild illness, recovery occurs within a couple of weeks. And there is still time to make a big difference in the severity of this pandemic. Each and every one of us is needed to slow the spread. Why should you take responsibility? Well, first of all, for those of us who are over age 60 or have certain medical conditions, we're much more likely to have severe illness or even die. So while many people will have mild illness, most people will have mild illness, there are those among us who are not so lucky. And when you slow the spread, when each of us slows the spread of this illness, we are reducing the risk to people for whom COVID-19 is dangerous. Another reason is the slower the spread, the less impact on the economy and the financial health of your household, of IPPI, of all U.S. families and businesses. We'll all be able to cope better if the spread is slower. And of course, if you don't get the illness and you're financially more healthy, you and your whole family will more likely to stay healthy during this time. Finally, if you are an IPPI employee or a subcontractor, compliance with preventative steps is required while you're engaging in IPPI services. So it's good for you, and it's an important part of your job or contractual responsibilities. So let's talk about some of the basics. I think you've probably heard about this in the news quite a bit over the last few weeks, but let's go over it again. Fever, cough, shortness of breath. These are the hallmarks of COVID-19. If you have these symptoms, call your doctor. If you think you have been exposed to COVID-19 and develop a fever and symptoms of respiratory illness, such as cough or difficulty breathing, call your healthcare provider immediately and follow their instructions. It's really important that you call ahead. Steps are being taken to separate those people who may have COVID-19 from other people who are waiting at doctor's offices or emergency rooms. So by calling ahead, they can give you good instructions and make sure that they're ready for you when you arrive. Call IPPI as soon as it's safe to do so. If you're an employee, don't come to work. And call your supervisor. If you're a home provider, avoid close contact with individuals that we serve and call your coordinator. It's really important that you let us know as soon as possible so that we can take steps to assist you and also to protect other people in the IPPI community. Be aware that COVID-19 shares some other symptoms with flu, such as fatigue and aches and pains. But these three, fever, cough, and shortness of breath, are really the hallmarks of COVID-19. How does COVID-19 spread? Most importantly is the person-to-person spread. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet, through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Spread from contact with contaminated surfaces or objects is also possible. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. And I saw today some research that indicated that virus can live on objects for up to 3 days and stay in the air for several hours. But there's no proof that this is the manner in which it spreads. We do know that person-to-person spread is occurring directly from person to person who are in close contact. So preventative steps for you and for the people that you support. And I'm sure you've heard about these through our emails, through postings in the offices and the news. But I'm going to go over them again because they're so important. Cover your cough or sneeze with a tissue that you throw away immediately. Wash your hands fully and often with soap and water for at least 20 seconds. Do this upon arriving at any of our programs or arriving at the offices. Do this when you get home or when the person you share your home with arrives home. Do this after using the bathroom, blowing your nose, or coughing, and definitely before you eat. There is advice out there that when soap and water is not available, to use hand sanitizer, but understand that hand sanitizer is in very short supply. So please wash your hands and take full advantage of the opportunity to do so. Don't touch your face. This is so hard to do. I was on a call this morning and people were saying, Le'Ann, stop touching your face. It's a struggle. I tell myself, sit on my hands, put my hands in my pocket, hands down, whatever way that you can help yourself develop the habit of not touching your face. Clean frequently touched surfaces daily using household cleaners. This is really important. That we're talking about high touch surfaces. You don't have to clean your whole house every single day. You need to clean those surfaces that people frequently touch. Doorknobs, countertops, keyboards, shared devices. Those are the things that you really want to get every day. Household cleaners will work. Be aware that touch screens can be damaged by say a Clorox cleaner. You want to use cleaners that are recommended for touchscreens when you clean them. And finally, stay home if you are sick. Even if your symptoms don't match COVID-19, this is not a time when we can afford to be spreading any sort of illness through our programs. So please stay home if you're sick and avoid close contact with others who are sick. What's close contact? I've used that term a couple of times, so let's talk about what it means. Close contact is defined as being within 6 feet of another person for a prolonged period of time. Close contact can occur while caring for, living with, visiting, or sharing a waiting area or a room with a sick person, or having direct contact with infectious secretions of a sick person, so being coughed on. So close contact is not just merely walking by another person. It really means you are near them for an extended period of time in close quarters. Or if you walk by somebody who is sick and they cough or sneeze right on you, so those drops get on you. I want to take a moment to emphasize that we should be assisting the people that we support, the people in our group homes, in our shared living arrangements, in our day programs, and in our schools to follow these same procedures. That's part of our support to them, is that we teach them and show them and cue them to use these same preventative steps. So model good prevention practices, make sure we're practicing what we preach, Explain to people that we support why these practices are important, but you don't need to scare them. Just make sure that you use terminology that they can understand. Teach those preventative skills. Not everybody knows how to do all of these things. So brush up on your prompting and reinforcement for practicing these skills. And when you see someone covering their cough, washing their hands, make sure to let them know they're doing a great job and you appreciate them taking good care of themselves. Monitor the use of prevention skills and direct their use when needed. So if you notice that someone isn't using their skills, make sure you tell them, hey, after you use the bathroom, you need to wash your hands. Or, hey, we're going to eat, so why don't you go wash your hands and then we'll have dinner. Post instructions with pictures as well as words wherever they're needed. Might be helpful to post it in the bathroom near the sink, instructions for how to wash your hands appropriately. Post reminders at the entrances to buildings to remind people to wash their hands when they come in. And of course, carry hand sanitizer, tissues, cleaning wipes, and a trash bag when you're out in the community with people, because you're going to need these things, and you can't follow these skills if you don't have the materials. Consult with your supervisor or one of the clinicians if behavioral challenges are interfering. We know that some of the people that we support do have some difficulty learning new skills or carrying out things that they're asked to do, so get some help if there are behavioral challenges. And keep offices and programs stocked with needed supplies. This can be a challenge right now. I know in New Hampshire where we are, we've got everybody scouring the stores looking for tissues, soap, hand sanitizer, gloves, wipes, cleaners. Make sure that you're doing the same. This is an all-hands-on-deck effort in every way, and that includes trying to find supplies. So if you find a lead on where we can get these things, please let the person know who's ordering supplies for your state. A word about travel. If you plan to travel, check the advisories on coronavirus.gov. We're going to go to coronavirus.gov in a few minutes, and I'll show you around that website. And there are travel advisories there about what's going on. We're urging people to reconsider non-essential travel. And the reason for that is the situation is just changing so rapidly. Yesterday, when I first wrote this presentation, I was talking about not traveling to places with level 3 advisories. Last night, there was a ban on travel coming back from Europe. So we already have that change. At this point, I want you to think about, do I really need to travel? Because it could change in any time. You could go somewhere and get stuck there. In New Rochelle, New York, there's a 1 mile radius closure of the town. You don't want to end up someplace where you don't want to be and unable to get back. And of course, you also don't want to be exposed to the coronavirus. Please inform your supervisor of any travel to areas that are affected by an outbreak by either you or a member of your household. If you have traveled to an area with a widespread outbreak, you may not enter an IPPI office or program for 14 days after your return. So if you have people that you supervise and you know they're out of town, you're going to need to be checking with them about where they've been when they return before they come into an office or a program. Please check with your HR folks if you have any questions about that. And of course, if you have traveled, make sure that you're following the CDC's recommendations for self-monitoring, and that's also available on coronavirus.gov. I'm going to talk now about very important preventative steps you can take called social distancing. And this is the big part of mitigation. This is when you're really moving from containment to mitigation, is there's a strong emphasis on these social distancing steps. There are a number of them that we're going to talk about, and which ones get implemented depends on what's happening locally in your area. So we'll go through them. The first is staying 6 feet apart. Droplets can't travel very far, so this is a very effective way of avoiding exposure to the virus. As you can see from this photograph, this was a recent Pentagon briefing where they separated the chairs so that people would be the appropriate distance from one another. Avoiding indoor spaces that are crowded or poorly ventilated. There does seem to be a pretty strong pattern of cases that have appeared that are connected to people that have shared a space that was either crowded or poorly ventilated. So, for example, cruise ships, nursing homes, churches, places where people are sitting next to one another and the air circulation is not that good. Avoiding handshakes, hugs, and kissing. So people have been substituting fist bumps or elbow bumps instead. Altering schedules to reduce mixing or gathering of people. So, for example, we have a day program in New Hampshire where everybody starts their day at 9 o'clock. So at 9 o'clock, a whole bunch of people show up at the same time and then head out into the community to do things. So if we wanted to enact social distancing in that program, we might ask people to come to the office at varying times or stagger the day program hours. That would be altering schedules to avoid mixing. It also, another way you could alter schedules is if you have staff that typically work in a variety of different settings or go from setting to setting, such as an ABA therapist who goes from home to home, you might decide, depending on your local conditions, that we're going to have just one person focus on one program so that they're staying in the same location and not moving from location to location, potentially spreading any virus that they've been exposed to. One could consider restricting visitors to programs. I know this is what is being recommended in nursing homes right now, is that visitors be restricted or screened for illness. And it's an option that could be considered just to reduce the number of people who are coming in and out of our programs. Quarantining of exposed people, and that's something that we are doing now. So if we have people, as I mentioned, for travel, if they're coming back from France, they're staying home for 14 days just in case, which is quarantine. Isolation of those who are ill once people are diagnosed to keep them separated from close contact with other people. Canceling events, closing buildings, restricting travel. These are all options that are being used to various degrees around the country. Some of them are voluntary. I'm sure you're hearing about canceled events that people are choosing to do. We can certainly choose to cancel certain events within IPPI depending on local conditions or closing buildings. For example, we had an issue last week where we were concerned that perhaps an exposed person had been in the building, and we closed the building for 24 hours just for cleaning, just in an abundance of caution. And we're asking people not to travel abroad. We're also reducing our travel between the states so that we're not moving the virus around. Now, these restrictions can be voluntary or they can be mandated. So when a state declares a state of emergency or public health officials take action, they can require us to do any of these things at any time. So I urge you to prepare your household now. There's excellent resources at coronavirus.gov. And I'm going to take you there. I'm going to come out of my slides and go to coronavirus.gov and show you around this website. If you just type in coronavirus.gov into your browser, you'll come to this page. And there's some really good information here. It's divided into 3 categories. What you should know, which is all about coronavirus, what it looks like, what to do when you're sick, what the symptoms are. The second section, which is about situational updates, a summary of how things are going overall in the U.S. and across the globe and what the CDC is doing. And then this third category, information for communities, schools, and businesses. Really good stuff here. And I just want to take you to the page for planning at home, because I urge each and every one of you to do this. This will help your family, and it will help us here at IPPI because you'll know what things that you're prepared to do and when to talk with us about things that are going on for you. So resources for home, there's a plan ahead section, and I would urge everyone to read this plan ahead section about getting your household ready for coronavirus. And this is especially important to us here at IPPI if you are a home provider for us and are sharing your home with individuals with disabilities. But this is really good guidance for everybody. So before you have an outbreak, plan ahead, a household plan of action, and practicing good health habits. Being prepared if your child's school or child care facility is temporarily dismissed, and planning for potential changes at the workplace. So I urge you to go here, read through this, and develop a plan for your home. Another area that I want to show you is about people with high risk. We know that we support many people who are at higher risk from the coronavirus, and many of us as employees and home providers may ourselves be in this category of higher risk. So I want to direct your attention to this section as well, that this is really important for you to take a look at. There's many recommendations here about how to get ready, how to take precautions that are more detailed than some of the more general precautions, and having a plan for what to do if you get sick. So I urge you to read that as well. Finally, we're going to come back to this section about what to do when sick in a minute. I want to talk a little bit about what happens if an individual we support has COVID-19. As I mentioned earlier, as of today, we don't have any individuals that we support that have the virus. But it is our goal to continue services with as little disruption as possible and to use the same resources and methods that anyone in the community would use. So we're going to go back to the coronavirus.gov website in a moment to talk about what it looks like when somebody is sick. We're going to follow all the guidance we get from CDC, public health officials, and our funders. The states have different approaches. We have different kinds of programs across the state, so the exact response will vary by state, but we're going to follow all of the guidance that's given to us. I can tell you that students and day program participants will be sent home if they are ill. Any in-home ABA therapy that's scheduled for a client or a child who becomes ill with COVID-19 would be canceled. If somebody we support residentially is diagnosed with COVID-19, we will do certain things for sure. Provide personal protective equipment to keep everybody, reducing everybody's exposure. Training on how to use that equipment because the equipment has to be used properly to be effective. Instructions on how isolation will be implemented with this person. When we go back to coronavirus.gov, you're going to see that part of what should happen if you get sick is for you to be isolated from other people to reduce close contact. And so how that happens in a group home might be different from how that happens for someone who's currently living in a home provider arrangement or someone who's living in an ICF. So you'll get individualized instructions and consultation with the environment about how we're going to do it for each particular person. We'll provide information about what symptoms or changes need to be reported and to whom, or when you should call 911 if you're supporting a person. And of course, we'll provide additional support as needed for, to access medical care or deliver medical care, or to operate the household, get access to groceries, medications, those kinds of things. So now I just want to take us back to coronavirus.gov and go to what to do when sick. So as we mentioned before, if someone is sick, we're going to call their doctor right away and get direction. Have that person stay home except to get medical care. And we're going to separate that person from other people and animals in their home. We will have selected a place where they can have their own bedroom and, whenever possible, their own bathroom. And we're going to avoid close contact with that person. Obviously, when we're caregivers, we're going to help people bathe, dress, eat, all the kinds of things that we do now. And that's where the personal protective equipment will be really, really important. So washing hands, as it says here, washing hands, wearing a face mask, those will be things that we do as part of our personal protective equipment when somebody is isolated. There are other steps that we may take in response to the outbreak overall. We will be using Send Word Now for urgent communications and to alert you to changes. So if you haven't signed up for Send Word Now, please do that. We will be sending out information about how to sign up, so if you haven't signed up yet, please do that now. We may be reassigning employees to different programs to make sure that we have appropriate personnel. We may close offices or programs in order to protect people. We may open alternative programs or homes so that people who can't stay where they are have some place to go that's safe for them and the staff. You may see managers and administrative staff working remotely, and that'll be a decision that gets made locally based on the conditions about whether we have people come to the office or work from home. We will be replacing in-person meetings with Skype meetings or conference calls, and that could be both internal meetings and external meetings. We don't have a policy that we aren't going to have in-person meetings right now, but you may hear that we are changing to a Skype meeting on particular occasions, or locally in particular offices deciding that all meetings will be Skype meetings. Know that these Skype meetings can be used for external meetings as well. So if we need to meet with teams or parents or others, we can invite them in as guests into our Skype calls. And Skype is the preferred method because our Skype for Business is HIPAA compliant. You may also see supervision of services or monitoring of services via Skype or other HIPAA compliant online applications. So we're really going to take full advantage of all of the online services that we have available to us. We'd like you to stay in touch with us. So make sure you read your email and text updates that you get. Please watch any future webinars that we put out. Contact your supervisor or your coordinator right away if you or any member of your household or any of your close contacts shows symptoms of COVID-19, fever, cough, shortness of breath. Please contact your supervisor, HR, or your state director if you have any questions about preparations. They're available to answer your questions. We want to make sure that you have the information that you need. And most importantly, keep calm and carry on. We're all in this together, and I know we can slow the spread of this virus as long as we all take the same precautions. Thanks for joining us, and have a great day.